Mental Health Colorado was founded in 1953. We have a mission which is to promote well-being, increase access to care, and end discrimination.
We follow all of the legislation that comes in terms of what we will support and what we will oppose. And then also we write our own bills and we get policy change that way. Prior to 2020, we were very active at the state capitol. You can grab legislators in the hallway, sit and visit with them and talk about a bill. That's also how we recruit a lot of our legislators to carry bills for us.
Mental Health Colorado has been a vital partner in making sure that we're crafting policies that actually address these systemic issues.
I really rely on advocates to bring some of these issues to the forefront. They really appreciate, I think, having a diversity of opinions at the table.
Mental Health Colorado has been my partner since day one. Nobody has their finger on the pulse of what the community needs in the mental health space more than Mental Health Colorado.
We had 8 bills in 2020 that we were bringing forward on all kinds of different issues, and then the pandemic hit. And that changed everything.
This past year has been one of the most challenging years that we have faced in our living memory, taking a tremendous toll on our anxiety levels and our stress levels.
We have to acknowledge how much the pandemic affected all of us. We have seen in the screenings on our website a huge spike. In terms of anxiety, the increase is over 500%. And in terms of depression, it's over 600%.
People were stressed and we needed to figure out, as Mental Health Colorado, how do we support them in our work? But the budget went into a free fall.
The legislature went into recess. Any bill that had money on it, if it had a dime on it, it wasn't moving forward. So all of our bills got stalled and we lost quite a few.
It was hard as individuals and everyone felt it. And for the first time, mental health really started to be part of the conversation much more than it had before.
I think people are starting to realize that it is okay to not be okay.
There's definitely more of an awareness around the importance of access to mental health care and making sure that that is seen evenly with physical health.
All of this new receptiveness to the urgency of mental health work has created this unprecedented opportunity to make change happen. But we need to get this right.
We need to change the way we're thinking about this. I think we're making progress. Mental Health Colorado is always there at the table.
It's like all of a sudden everybody woke up and said, hey, we have a crisis. And I will ride that wave, creating transformational change. And Mental Health Colorado makes that happen.
All of the areas that we're working on really cannot continue to move forward without the donations of all of our supporters to be able to help us work with the county commissioners, to help us to work with early childhood, to be able to work with the hospitals to create the kinds of programmings and access to care that we need.
The only way that we can be the voice of consumers, of family members, of youth who experience mental health and substance use conditions is by the donations that are given to us to sustain our organization. We are a force to be reckoned with and we will change the system, but there's a lot of work to be done.